Hi, my name is Michelle. I'm recently 56 years old. I came to Dr. Bloom's practice when I was 54, struggling with menopause symptoms, hot flashes, weight gain, sleep interruption, mood swings. Did I mention mood swings? And just really trying to find a way to sort of make it through this next stage of my life. And so we came in and did a consult. I cried in that consult because he was so thorough and just really explained what I've been experiencing for the last 4 years. My mother had breast cancer in her 50s, and so when I entered menopause, I was told I couldn't use HRT, and so I just sort of basically would have to just suffer through the symptoms until they minimized. By the time I came to his practice, I was at the peak of those symptoms and really struggling in my day to day life, trying to uh, recover from not sleeping the night before, having a really high stress job, and just not liking how my body was feeling. I think the most impactful thing about Dr. Bloom's practice that he really is an educator about a woman's body. I'm intrigued as I talk to my friends and I share the information I've learned from Dr. Bloom, how they simply don't understand how our bodies work, in the sense of how estrogen is such a huge a factor. I mean, all human bodies run on lots of different hormones, but a woman's body and the estrogen relationship is so impactful, from your hair breaking out, your nails falling, your skin drying. And it's not just about having a menstrual period. And I think when we are younger, we focus on our reproductive health in that way, thinking about it that way. But once you're done having your babies or just your body's now shifting to something else, I think we haven't thought through what to talk to women about once we're no longer producing, offspring, right? And that women are living longer. Menopause is relatively a new experience for most this society because women just didn't live as long as we're living now. And it's been so impactful. I literally cannot go a week without talking to any woman. I've stopped complete strangers in the grocery store who's holding a fan and looking miserable, and I have his business card and a sample of what the protocol looks like in my phone just for that reason. And I walk up to random women in grocery stores, at gas stations, in 7-Elevens, and be like, sis, can I tell you about Dr. Bloom? They're always like, what are you selling? Nothing except freedom from feeling so miserable. It really, I think I'm now 16 months into my protocol. It has literally within a month, no hot flashes. The mood swings elevated in about 2 weeks. My libido is back intact. No more vaginal dryness. Dr. Bloom really worked with me to sort of titrate my specific needs. So it's not a blanket like here, everybody gets estrogen. So I'm on estrogen, progesterone, and a little bit of testosterone. And he really worked with me to find what works for me. So I could, again, when I walked into his office, he was like, what is your goal? And I was like, I just want to feel like Michelle. And I just kept looking in the rearview mirror and seeing less and less of a version of her. And so this is what I look like on HRT. I'm so grateful for his practice, his knowledge, and specifically his patience about answering all my questions before we even dived into this. So I'm happy to just sing his praises. Literally was just talking about it at 11 o'clock last night with a friend who's miserable and going through the same thing I was going through. So I recommend Dr. Bloom highly. This is the best investment, period, full stop, that you're going to take care of yourself in this stage of your life. So thank you.
Thank you so much. It's an honor to be your physician.
Thank you.